everybody. It's Karen Anderson with aortichope, and you are here tonight with us for this awesome, wonderful live event talking all about prescriptions and all of the medications that we happen to take in the aortic community. And I'm so excited to introduce with us again Dr. Kristin Watson. Why don't you go ahead and tell everybody a little bit about yourself? Welcome.
Sure. Thank you again for having me back. I always love participating in this activity and getting to talk to you about your questions related to medicine. So I am a cardiology trained pharmacist. I'm a faculty member at the University of Maryland School of Pharmacy, and I have the pleasure of serving to care for veterans within the Maryland health system. And so educating people about their medications and why we take them is such a pleasure and an honor for me to be able to do.
It's so wonderful to have you here because obviously we all in this community end up on some type of medication, some way, shape, or form. So this is a lot of information that we're going to present, which aortichope will have on the website. We will also share it on Facebook. Excuse me. So as we've always done in the past, we're going to do the presentation, but please feel free, if you're watching this live now, to put your comments or your questions in the comment section below. Don't forget to like and subscribe. There's also a link if you'd like to ask an anonymous question as well. So you can click that, fill out the form, and we will talk about your question and keep it anonymous online here. And we will try to answer as many questions as we can. If for some reason you're seeing this after we've done this live and it's taped, also feel free to ask some questions. We'll get them answered for you, which will be in the future from now. All right, so let's jump into this presentation because it's so exciting and this really gives people a chance to understand what they're putting into their systems and why.
Yeah, great.
Okay, we will be right back. We're going to start this presentation. And as we're starting this, Kristin, I do want to make sure that everybody in the community knows that we are not making suggestions of alternate drugs that you should take or any changes that you should make. This is merely a great educational tool to start that conversation with your physician. Something to bring up if you have a question, if you're not feeling great, if you're noticing that you're having some side effects, this is a great time for you to take notes and have that conversation with your physician afterwards.
Yes, absolutely. So we're going to be going over the common medications that you may be on now, you may be on in the future, maybe one of your loved ones are on. And so a lot of people with aortic disease, there's a lot of different options. And really, we're going to be talking about blood pressure control, because as you all know, blood pressure control is such an important component of managing folks who have aortic disease. And so like Karen said, it's not to say, hey, this medication is better than another one, or this medication class is better than another one. It's that you're informed. And then, like she said, you can ask those questions. And I know for myself personally, I know cardiology medicines really well, but if I'm put on another medication that I might not know as well, and I see that list of information that comes with the medication, that can be pretty overwhelming. So, and one of my goals is really to be able to kind of narrow down for you. So what are some of those most common side effects, or the things that can actually happen in patients, maybe versus the gamut of things that have been reported. So we can go ahead to the next slide. So the first class of medications we're going to be talking about are the angiotensin converting enzyme inhibitors. A lot of people will, you can think of these if you're on one of these and have the generic name listed on your bottle. They end with they're pril. So they'll end with PRIL. So these are very effective medications for lowering blood pressure. And these are commonly used if patients also have diabetes or heart failure, because they have benefits, and in patients with chronic kidney disease too, because they can help delay progression of kidney function getting worse in people who might have some kidney decline in kidney function over time. And then they have a different benefit in those with heart failure. So you can see there's a lot of different medications within this class. One's not better than the other. They just differ in frequency of amount of times per day that they are given. And in certain regions of the country, we all are familiar with one, or even within a certain institution, we all just have one that we go with because you know the dosing with that and you stick with it. So where I practice, lisinopril is our go-to, but you could go to another hospital 10 miles away and they might be big fans of enalapril. And there's none of us are right and none of us are wrong. It's just what you're used to prescribing. So go ahead and you can click again.
I do have a quick question.
Yeah.
Sorry to interrupt, but as with all of these medications, they are the time it takes for them to go into full effect differ. And I don't think a lot of people realize it's not like taking a Tylenol where in 30 minutes it's going to take effect and your headache goes away. As you go through these different classifications, can you mention that? Because I think I understand some might take 2 hours to go into effect, and that plays in part as to the importance of why you should take these drugs at the same time every day.
Yeah, that's a really great point, Karen. So when we start out on most of our blood pressure medications, you can start to see blood pressure lowering benefit within the first day or so. But oftentimes patients are going to be starting on the lowest dose, and then the dose may be increased or another medication may need to be added on. And we have one exception, which will take several days to really kick in. And I'll cover that when we get there. Thank you for bringing that up. And when we think about trying to help keep someone's blood pressure under control and starting on medication, we're not in a race to do that, except in rare circumstances to bring it down quickly for someone. And so if you're started on a medication and you're not at your goal blood pressure in a week, for most patients, that's okay. It's going to take time and it's going to take adjustments. If we rev up the doses too quick to try to get people on blood pressure medications or add a lot at once, there can be the risk of lowering the blood pressure too quickly. So this hypertension or high blood pressure is a chronic condition. So because it's a chronic condition, in most circumstances, we don't need to be in a rush to get the numbers down quickly. Now, that may be very different than maybe if you presented for the first time with aortic disease in the hospital. That's a different story. But in the outpatient setting, it's slow and steady helps win that race for all of us. And I think one question that comes up for me before I delve a little bit more into this medication is, yes, I know you're here because you have aortic disease, but you also may have hypertension or high blood pressure. So a lot of people will say to me, I feel fine. My blood pressure numbers might be up. I feel fine. Hypertension is called the silent killer. And the reason it's called the silent killer is it's not until we have a problem with our blood pressure being high that we may realize it. And so what consequences can be with blood pressure being too high over a period of time is having a heart attack, having a stroke, our kidneys losing their same function over time. So while we may feel good if our blood pressures, most people don't feel any symptoms of high blood pressure until something happens as a consequence. So I think that's an important component that sometimes we, maybe miss out on when we're educating folks. And sometimes, like many of you, I'm sure we get a lot of information when we're at a visit, right? So I always think it's helpful to reinforce certain concepts over and over again, just so we're making sure we're all clear. And we all know that there's a lot of stuff on the internet about there. So sharing that with you. So in terms of the great thing is when we talk about our blood pressure lowering medications, they're relatively safe classes of medications. So with the ACE inhibitors, they can cause a dry cough. And I will tell you, oftentimes this dry hacking cough people will have, oftentimes it may not bother the patient, but it's going to bother their partner or somebody that they live with. The good thing is that cough is reversible if it is bothersome. And you can be switched to another medication class, and that will resolve fairly quickly. So if you notice that, please be sure to let your provider know, and they can kind of figure out, is that cough potentially from this medication. And it's not something that like, hey, you started today, you're going to have a cough tomorrow. It can happen during the course of therapy. Dizziness or lightheadedness, you're going to see this, I think, for every medication listed here. And especially when you're starting new doses of blood pressure medication, something that can lower blood pressure, or that dose is being increased. Always telling my patients, please don't get up and jump out of your chair and get moving and grooving, no matter how good you feel. It's always good to stand up, give yourself a few seconds, tell people to count to 11. I like to tell them 11 just because it's fun, not to count to 10 like everybody always thinks, and then go ahead walking. And as we get older too, our bodies just don't adjust as well as they did when we were 5 years old, from getting up off the floor and sprinting around the house. Like I have a 3-year-old, and at speed at which he runs around our island, we can't keep up with him because we get dizzy, right? So that changes for us over time. And then there is a rare side effect with this medication called angioedema, and that means lip, tongue, or throat swelling. If you would ever notice, right, this is with any medication or anything, anytime you would start noticing lip, tongue, or throat swelling, that is a medical emergency, and you should seek medical attention immediately so that can be addressed. So to sum it up, ACE inhibitors are great blood pressure medications. There are things that end with pril. Big side effect, the most common side effect we hear from people is a dry cough. And if that is bothersome, they can switch that. And then if you can click again. And so with this, you will require some blood work a few times a year, just to keep an eye on your potassium levels, because this can increase potassium, and monitoring your kidney function as well. So you can go ahead to the next slide. So the angiotensin 2 receptor blockers, I call these the cousins to the ACE inhibitors that we just talked about. And these end with artan, and some of these are available in the generic form. Many of these are once daily, and similar to the ACE inhibitors, when we're talking about treatment for blood pressure, that there really is not, one's not better than the other. Now, there is a medication in this class called losartan, and that is commonly, and now I'm seeing I might not have that on my list. Losartan has been studied a lot in people with aortic disease, and but even though it may be, so some people may have a preference for prescribing that one, it's the agent within the class that has been most studied. So I don't think we can say it's better than all the others in the class. It's the one that investigators have just probably were like that drug a lot for whatever reason. It's a once daily medication, and studied that in people with aortic disease. And so go ahead and click again. And so the side effects, this one doesn't have the cough. So if a patient gets a cough, if you would develop that cough on the medications on the last slide, they would most likely switch you to this class of medications. They work very similarly. They have the same benefits, but that cough is not present. And that risk of that lip, tongue, throat swelling we talked about is possible, but even lower for patients. Go ahead, next slide. And same thing, your potassium and your kidney function will be monitored. And so, or it should be monitored. And if you haven't had routine blood work and you're on one of these medications, it doesn't hurt to speak up and say, hey, you know what? I haven't had my blood work done. I think you should have it done at least once a year. And we all know we have so many providers that are taking care of us. It's good for us to try to be our best advocate if we can as well. Okay, next slide. So beta blockers. So for people who have aortic disease, lowering blood pressure is really important to do, but it's also really helpful to keep heart rate under control. And so we have various different medications within this class as well. And so you can see those medications listed here for you. There are way more medications in the beta blocker class. It would probably take me almost the whole slide. This class of medications has been out for ages and ages and ages. But these I have listed on the slide here are the ones that we most commonly see used in practice. And so these medications, if you're on one of them, the majority of these are generic and they'll end with LOLs. They are not laughable. They are really very, very good medications. And so their job is to keep heart rate under control and lower heart rate. Some patients may get a slight blood pressure lowering benefit, but their role is not to lower blood pressure. And then, so if you can click again. And so it looks like there's a lot of side effects with this one. My 3-year-old is trying to break into my office where I am, so you should try to hear my dad's after him. I apologize. So side effects of this, some people when they first start it may say that they feel a little tired when that happens. I would say because of how they work, and in some patients we know based on if someone has heart failure, we know that these medications are especially helpful. Usually within a week or so, people will kind of get their pep and their step back. So give it a little bit of time. Dizziness or lightheadedness, like I said, with any of these medications is something that it can occur. And sexual dysfunction can happen. Now, the one thing I will, sexual dysfunction is possible. People who need sexual dysfunction namely erectile dysfunction, can also occur due to different medical conditions. So people who have medical conditions which require the use of a beta blocker, that medical condition can also increase that risk for erectile dysfunction. So it's really hard for us to discern what is causing it. So what I always talk to my patients about is especially if any of you have heart failure, I don't have an option to replace the beta blocker, but I do have things to treat your erectile dysfunction. And I know that may not always be, a little bit of a side, the most comfortable conversation to have, but sexual activity is a very important thing for quality of life for patients. So if you think you are having that side effect, or that could be occurring as a result of maybe some of your conditions, please speak up to your provider. They're going to be very happy to talk to you about that and come up with treatment options. Now, for those of you who have diabetes, and if you are on insulin, beta blockers can mask, or you may not experience all those symptoms of hypoglycemia, or low blood sugar. So that's why it's a really important thing to monitor your blood glucose, but you guys are all over that as well. You may see, and when you look at the pamphlets that you get for this medication, it talks about, you may see concern in people with lung disease. For most people who have lung disease, such as COPD or asthma, this is going to be okay. But I would want you to report if you notice you have any additional shortness of breath. The same thing for someone who has heart failure. Again, the risk of worsening side effects is not great. It's not very high, but it's always really important that we want you to be monitoring for these things on your own and to report that so we can ensure that we do the best thing for you. Go ahead, next slide. And with this medication class, you really want to talk to your doctor before stopping. And that is because many people with aortic disease, keeping that heart rate low, I shouldn't say low, towards the lower end of normal is really important. So you would want to work with the person who manages your aortic disease to come up with the best treatment plan. Go ahead, next slide. So non-dihydropyridine calcium channel blockers, you don't have to remember what that class of medications are. This class of medications, similar to beta blockers, lowers your heart rate, and they can be really good at lowering blood pressure too. I bolded there the generic names, so Thiazides and Verapamil. There are a lot of branded names for these two medications, as you can see listed on the slide here. And so they just work a little bit differently in the heart compared to the less class of medications, but are effective for lowering heart rate in people who may need additional lowering on top of a beta blocker, or someone who may not be able to tolerate a beta blocker. Go ahead and click again, please. If someone does have heart failure, this medication class is not optimal for that patient group. Go ahead and click again. This medication class, while they're really good, they do have drug interactions with statins, or like Lipitor, Zocor, or Torvastatin. Or should say, sorry, like simvastatin is where they'll have drug interactions. So that's why it's really important. And I know probably all of you do this, but it's always a good reminder, making sure to fill all your medications at the same pharmacy so that the pharmacist can always run that drug interaction check, because unfortunately, they don't always pull in all of your medication records. And so there's a potential for that to be missed if everything's not filled at the same pharmacy. And that even goes when you're like maybe getting a one-time prescription for an antibiotic. It's best to always have things filled at the same pharmacy if you can. Okay, click again, please. Now, side effects can cause constipation. And the risk of constipation is pretty significant with this medication class. So if you would write one of the biggest keys, and I see Karen sipping her water over there, one of the biggest keys to preventing constipation, this medication class or in general, is making sure we're eating foods high in fiber, making sure we're drinking plenty of water. So, you know, for most people, 6 to 8 glasses per day. And then we have a lot of over-the-counter products that we can use for constipation as well, if that would develop. And I'm happy to answer questions about that as well. And then it's a unique thing that can happen with the gum, but I know you guys are all awesome in getting your dental checks every 6 months. So they would just notice if anything was going on there. Okay, go ahead, next slide. And so Karen asked in the beginning about medications and their time to when they start to kick in and work. So the important thing is, with all medications, we should be taking them the same time every day. I am a pharmacist. I sometimes forget at least once a week to take my nighttime medications. I'm embarrassed to say that, but I do. So you should never feel ashamed if you make a mistake. And there's always different strategies that the 2 pharmacists in my house are trying to do to make sure I don't miss my nighttime medicine. But these agents, if you are started on amlodipine, that one particularly, and that is the one that's most commonly used in this medication class, it takes a few days for blood pressure to start lowering. So if I would be, if we're starting somebody on that, in the hospital setting, we wouldn't expect to see any benefit for several days. And the same thing in the outpatient setting. So I would tell my patient, you know what, don't even start checking your blood pressure till next week. So, and again, like I mentioned before, it's slow and steady with lowering the blood pressure in the majority of cases. You'll see an asterisk there. Some of the products for nifedipine, the drug comes out is released from the capsule or tablet within the body, but then the tablet comes out in your stool. So if you happen to look in the toilet and you saw it there, that is okay, and that is expected. That is how the product is made. Go ahead, next slide. Next click, please. So side effects with this. So you may hear the term peripheral edema. Sometimes I know the medical jargon gets used accidentally, or lower swelling, lower extremity swelling. So some people can get swelling in their ankles with this, and that really can occur with higher doses. There's no treatment for the swelling that occurs with this medication class. The answer is try to lower the dose a little bit, or if it's bothersome, which it's okay if it's bothersome to you, we would look for an alternative treatment option for someone who has that side effect if it's bothersome. Like taking a water pill is not going to be the answer for that. And some people can experience headache and flushing, so their face getting red or feeling hot with taking a medication in this group. Go ahead, next slide. So Clonidine, this is a really important one with the timing of taking your medication. So this one is a very quick onset of action so it's lowering blood pressure very quickly when it's taking effect very quickly, I should say. And it has to be for patients taken 2 to 3 times per day. Now, taking 3 things 3 times a day can be really tricky and hard to do. I know I personally that I would have to have alarms on to make sure that I remember to do that. So fortunately, there is a patch. So if you are someone who gets put on Clonidine, sometimes they'll start you on the tablets to make sure that you can tolerate it, but then eventually can switch over to a patch, and that way you don't have to worry about taking the medication 3 times per day. And if any patch, this patch, any other medication patch, the same applies to injections. So if you're taking something like insulin, making sure for the patches, making sure you're rotating where you're placing the patch. If you're taking injections, make sure you're changing the site of injection. That just helps with any skin irritation that could occur from this patch specifically. Okay, click again, please. This is another one that's really important not to stop suddenly. And the reason for this, so say my systolic blood pressure, the top number blood pressure for me before I started on this medication was 138. Well, what could happen if I stopped it suddenly? My blood pressure could go higher than what it was to start with. So it might go up into the 140s. So we want to make sure we don't stop this medication suddenly unless, right, if you're under supervision and someone is doing that. But please don't stop this one on your own because we don't want to risk your blood pressure just bouncing up too high for you. Go ahead and click again. Now, this medication can cause heart rate to be lowered. And we talked about dizziness and lightheadedness. This can cause, especially as people start to get older into their 60s and higher, it can make people tired, really fatigued. And we often recommend using it in older patients, probably even more so getting into our 70s and higher, because it really can make people drowsy. People have because of how it works and dries things out like your mouth. If you're a contact lens wearer, what you might find is your contacts just don't feel as nice as they used to in your eyes. And then constipation and nausea can also develop as well. Okay, go ahead, next slide. So Thiazides, some people may talk about these being your water pill, but these actually are, in fact, sometimes you get a little bit of a water pill effect when you first start these medications, but that quickly goes away. And so the medications are listed there for you, and there's 3 within this class that are commonly used. And the nice thing is these are all once a day medications, as are most of the earlier medications that I talked about as well. So which can be really helpful for people like me who sometimes forget their nighttime dose. And I think that's an important thing. Just admit it, right? I have patients who tell me all the time, I can't remember that second dose. Okay, well, that's my job to work with you, right? Our jobs are to work together to develop the best plan. So, and before I would put somebody on a twice a day medication, I'm always going to ask them, do you think this is going to work out for your schedule? So if it's not working for you to do 2 times a day, please speak up. And, people can talk to you about options to help you remember. But fortunately, when it comes to blood pressure lowering medications, we have a lot of once daily options that are available to us. So there, you can see the side effects are listed here for you. Typically in people who have, you may see in there that gout is a side effect. And if you've ever had gout, or if you know somebody who has gout, that can be pretty painful. So if someone's having frequent gout attacks, this would probably not be something we would add, but I wouldn't be worried if, for me, I've never had a gout attack. And if I started this medication, I wouldn't be concerned that it's going to cause me to have gout. Does that make sense, Karen, how I explained that?
Absolutely.
Now, this medication class can make you more sensitive to the sun. I am a huge proponent of sunscreen anyway, but with this medication, you really want to make sure, regardless of your skin tone, skin color, that you are wearing sunscreen, because you are going to be more likely to potentially burn from this agent, right? And we know that sunburns can increase our risk of having skin cancer in the future, and they are, in the short term, can be very, very uncomfortable. And similar to some of the other medications we talked about, this medication class, it will check some of your blood work periodically. Okay, go ahead. Next slide. Thank you. Okay, I said no medication class is better than, right, for hypertension. We know some work better than others. This is my favorite medication class. And that's because these medicines have a lot of different roles for different people with different types of heart disease. So spironolactone, or Clarinone, called Inspirus, spironolactone's been around for a very, very long time, and it is a amazing medication to add on in people whose blood pressure they're having a hard time controlling blood pressure. And that's one of the reasons I like it so much, is because it's can be once daily for people who have what's called treatment resistant hypertension. So that means people are on several medications for high blood pressure, and their blood pressure is not being a goal. And as we talked about in this group of patients, controlling your blood pressure is just so important. And so with this medication class, and I think it's typically safe in general to avoid salt substitutes that look, sodium substitutes that look like table salt, because they have potassium in there. And if you're really shaking that on the food, you can cause your potassium levels to go up. And high potassium levels is not the best thing for the heart. So if we have somebody who is on this medication class, really talk to them about staying away from this, right? We know adding sodium to our food is not the best, but I always say find an herb that works for you. I'm a big, like garlic, I like rosemary. So what are those things that I can use that don't have that salt involved to season my food? So go ahead, next. So side effects, spironolactone in men can cause breast tenderness or swelling. And I will tell you, this can be very uncomfortable for a gentleman to bring up in practice, because I have had plenty say like, oh, they're embarrassed to bring that up. If it happens, please, if you feel comfortable with that provider, or a provider with whom you are comfortable bringing that up, please talk to them about it, because everybody's not going to get that. But if we stop the medication, we can switch you to the other medication, and somebody can switch you to the other medication in class, and that will resolve on their own. And sometimes I won't figure this out for a person until I place my stethoscope on their chest and I can see them, pull back a little bit. So, and then in women, this can cause menstrual irregularities. So, if you are sexually active and not, you're going to want to use you may want to use a form of birth control, just so you know what's going on. Some people will recommend there. And then with these medications, like I talked about, the medication itself can increase your potassium, so they'll do blood work on you as well. Okay, go ahead, next slide. And so our water pills. So everybody knows what their water pill is. I think, so the water pills are going to be used, so the medications here, so furosemide or Lasix is probably the most commonly used, but we definitely use our fair share of the other ones that are listed here in practice. And so these medications are going to be for people who have certain form of kidney disease or have heart failure and really need when that extra fluid is on board, it can cause things such as shortness of breath. So in most circumstances, they don't cause blood pressure lowering for patients, but it does have the potential to occur. And like I always say, everybody knows which medication is the water pill, because they're going to run to the bathroom shortly thereafter taking it. Okay, if you can click again, please. So this one is really important if you are on this and you get dizziness and lightheadedness, because sometimes what can happen is that if you're getting dizziness and lightheadedness when you're on this, it can be a sign that too much fluid is coming off. So we like to tell our patients, or I like to tell my patients, dosing of this is an art, not a science. So every patient is going to be different. Their dosing may change with this over time. So dizziness, reporting of dizziness and lightheadedness is a sign to us, say, hey, we're always investigating if you're on too high, too low, or the right dose. But dizziness and lightheadedness can be a good clue to us that too much fluid is coming off. And click again, please. If you are on this and you are asked to check your weight, it's important to check your weight at the same time each day. You know that, if you are eating, check your weight before you're eating. If it's waking up in the morning, make sure, you're either in your birthday suit or in your underwear, so that, right, in the winter and the summer, we're wearing different clothes. And the way the weather seems to go these days, we're in different weighted clothes every 3 days. So making it wearing the same thing and checking your weight the same time each day. And I will tell you, bringing that log, if you're writing it down, to your visit can be really helpful, because when you come, we all know how, sometimes appointments, you may feel rushed, or you're waiting a long time, and you're being asked a lot of questions. So sometimes remembering a specific number, and the same thing with your blood pressure, to remember what those number readings were. I couldn't recall them off of the top of my head, right? So having that paper is really helpful for the person who is taking care of you, so that they can kind of see how things have changed over time. So some of the people for whom I provide care, they have like copybooks and they keep a log of their blood pressure, their weight, their heart rate in there. And that is it's so helpful and informative. And you can even make yourself notes there too, like, I felt dizzy on this day, or, right? So keeping track of those notes, because as I tell my patients, I can't even sometimes remember what I ate for breakfast that morning without really thinking. So for me to expect you to remember a 3-digit number for multiple days is going to most likely be tough for any of us to do. Okay, you can click again. And same thing, you're going to get your blood work done, like with many of these medications, to keep an eye on your kidneys and your potassium as well. You can click again, please. Hydralazine is a very effective blood pressure lowering medication. The brand names I don't think anybody gets, because this is one of the oldest kids for treatment of high blood pressure, and its role is for lowering of blood pressure. So it doesn't provide any other type of benefit for folks. It is a 3 times daily medication, so keeping that in mind. And I should point out here, when we're talking about 3 times a day medications, we really want to separate that out evenly within the time that we're awake. So I don't want you waking up in the middle in your sleep to say, okay, it must be every 8 hours, because you may be like me and gets 9 hours of sleep, right? So I wouldn't want you waking up for that. But we want to make sure that we have it evenly spread out, because if you're taking your doses two doses too close together, your blood pressure could get a little bit lower, and then you could have a longer gap before you take the next one. So taking it 3 times a day is to ensure that you have the right amount of medication in your body the same time per day. And again, the middle dose, I find, for a lot of people, can be tricky to do. If it's hard for you to do that 3 times a day, please just tell your provider, so they can try to work with you on identifying a regimen that's going to work the best with you. Okay, go ahead and click again. This is a really good blood pressure. It's very effective in lowering blood pressure. So dizziness and lightheadedness can occur. Some people in the beginning will notice some nausea and vomiting with medication. And then because of those stomach side effects, the nausea, the vomiting, potentially diarrhea, people sometimes can get a loss of appetite when it is first started. Most people will say they start to feel better in a week or so, but for some people, the side effects, if it's bothersome, just let someone know so they can make changes for you. Go ahead, next slide. So we know for patients with aortic disease, but for all of us, smoking cessation, tobacco cessation is of utmost importance. And listen, it is an addiction. And as I tell my patients all the time, it is our job as clinicians to help. It is our job to work with you so we can find a strategy to help you quit. And I don't want you to be discouraged. If you quit before and you picked it back up, for most people, for many people, trying to quit once isn't going to be the end all be all with tobacco cessation. And like I said, it's an addiction, right? So there are a lot of different strategies that we can work with you on to help come up with a plan for you. So we have 3 medications that are available. Counseling for smoking cessation is really has been shown to help people stop smoking. And there's an amazing resource called 1-800-QUIT-NOW. And right, especially if you try to use nicotine replacement products like the Nicorette gum or those patches you can buy at the store yourself, they're pretty pricey. But with calling 1-800-QUIT-NOW, it's awesome because you get those counseling services. You have people who are trained experts with this. And all of your providers should be able to help you quit smoking when you're ready, or talk to you about, what might be holding you back. And you oftentimes you can get free nicotine replacement products from 1-800-QUIT-NOW. So and they're right there, right? So if you're like, all right, I'm ready to quit, but I don't see Dr. Watson for 2 weeks. Hey, I would rather you pick up that phone and call this 1-800-QUIT-NOW and let them get you started and talking on that. So they're always available for you. You can share that with your friends as well. Next slide. So as we talked about and Karen pointed out in the beginning, medication adherence is so important. So finding a schedule that works for you to take your medications at the same time each day. If you want to use alarm clocks, that can be really helpful for you. Personally, for me, it's very helpful to use a pill box so that if I have 3 kids in this house and a dog who's more, as some of you probably know, can be more work than a child, that if I'm like, oh, did I take it or not? Having that pill box is incredibly helpful because I can look at that spot and say, oh, yep, it's Wednesday morning. I took my medications already per day, versus like, did I swallow those pills this morning? Then I'm going to have to do a pill count in my box, right? So I'm a big fan of pill boxes. You can buy them pretty much anywhere. I have a very beautiful colored one that I use for myself. And then it could be alarms. You can work with your friend who knows on medications. Just even buddy systems are always good. When you have something that's written for twice daily medications, and so this has come up for patients, right? And they have said, well, if it says 2 times a day, why can't I take it all at once? And that's just because of the way the medication works, is that one dose will last you about 12 hours or so. And then we need to take that second dose again later in the day to ensure that we have a constant amount of our medication, right? And I can appreciate those questions, right? Because if it's twice a day, why? And if you have those questions, ask those questions. Why does it have to be twice daily? And somebody can explain that to you. I encourage you to always have questions and ask questions. And then 3 times a day, try to separate it by 8 hours. But if you're a person who sleeps longer, it's okay. Just, getting it as far out as separated by about 8 hours from each of those doses. And then really important is keeping your medications out of children, your grandchildren, if people are coming over, just so they can't so they can't reach that. Unfortunately, we have so many accidents each year with medications. And so whatever we can all do to help prevent that is awesome. And I say for the grandparents too, don't keep your pill boxes in your purse too, because kids, they go digging for stuff. Okay, next slide. And so here's different resources that are on here for about smoking cessation, things. If you have websites that I really like, if you're looking for resources for healthy diets for people with different heart conditions, and then great resources about your medications as well. And then go ahead, next slide. And I will happily answer any questions you have about the COVID vaccine. I get the lucky pleasure to vaccinate people and also help as a pharmacist pull up those doses some days. And I appreciate there's so much information out there about vaccines. So while we're here to talk about medications, I was saying to Karen, any chance we get to help educate the public about vaccinations or any questions you may have, I am happy to address that as well. All right, Karen, we have any questions coming in?
Well, I have a couple before
I know you always
check
write
in.
good questions.
You know that I do. So that was a phenomenal presentation. And as I mentioned before, we will have those slides available. We will also have those resources put at the bottom of this screen for this video. Couple quick questions. We often hear that grapefruit juice or grapefruit in general can affect the, can cause a decrease or change the effectiveness of antibiotics or other drugs. Can it do that with all these drugs you just talked about?
Sure. So what about grapefruit juice with some of these medications? So the only ones it could potentially play a role with are that diltiazem and verapamil. Now, that said, you have to drink a lot of grapefruit juice in a day. So as long as you're not on like a grapefruit diet, you're okay. If you like a grapefruit with your breakfast, go ahead and have a grapefruit with your breakfast. They're good source of nutrition, and they're not going to interfere with your medications.
Now, you had also talked about side effects. So I just want to clarify for everybody, if you had a side effect with labetalol, that does not mean you're going to have a side effect with Bistolic. It should not mean that, because at least from personal experience, I think most of us are put on labetalol when we leave the hospital. That's what I hear, but that knocked me out completely. And then very quickly, I spoke up. I said something. I never knew that I could do that before, really, and was moved to Bistolic. And it was like within a week, my whole world opened back up again. So that is true. Side effects with one does not mean in the same class you're going to have a side effect with another.
So it depends upon the medication class. Okay. So I would say, Karen was talking about the beta blocker medication class, and that is probably the one medication class that we talked about that you can see differences between. So I talked about the ACE inhibitors, or those ones end it with pril, that if they cause lip, tongue, or throat swelling with one, or that cough with one in the class, it's going to happen with another one in the class. But those beta blockers, they all work, some of them work on different receptors in the body. And so some people will say they may not feel as tired or sluggish with the one as they do within another class. So with that medication class, if someone does feel exactly how you described, feeling tired with labetalol, we will try them on something else, because we know how for certain people with certain conditions, that certain medication classes are really important. And yeah, labetalol is often the most commonly used for people who or carvedilol is what we often see people are just most familiar with using for people with aortic disease.
Okay. And one more before we check to see if we have any questions. Is it okay just to take whatever you're prescribed all at the same time, or should you spread it out 15 minutes, because I just pop them all in. And then I often wondered, maybe I should take my Bistolic and then wait a little bit and then take the losartan. And so I'm curious to know, is there a rule of thumb with that?
Yeah, that's a great question. So if you have multiple medications, can you pop them all at once? If there's a lot of chatter now for medications that are there to lower your blood pressure that it may be better to take at night. And so, but you can take them all at the same time. There are certain medications there are certain medications and supplements that we think combine together, but that's outside of the blood pressure lowering realm. Yeah, so if you feel fine taking all your meds at once, go ahead when it comes to this medication class. If there's anything that you would have to separate from something else specifically, there will be a nice label on there from your pharmacy. Okay. Now, I will say, if you do say, you know what, I always feel a little bit dizzy after I take if you're on a few blood pressure medications, like you always feel dizzy after you take them all at once, then separate them out. Take some in the morning if they're all once a day, and take some at night, because that might help you feel better.
Okay. All right, well, let me just do a quick check and see if we have any questions or comments. Oh, it is Greg Greenberg's birthday today. He's on our board. He's with aortichope. So we're just going to give a quick happy birthday, Greg, if you're watching, if you're with us. Hope you've had a wonderful birthday today. So we do have a question about resting heart rate. Would 50 be considered too low? And that's a great question because I know what mine resting is. Now I'm wondering if mine's too high. And I know that that's probably dictated by your cardiologist or surgeon, but what are your thoughts on that?
Yeah, so the question is about, is a heart rate of 50 beats per minute too low? Everybody's different. So for everybody's different based on your physical activity level, what your kind of is going on with the heart itself. When we get worried about a heart rate being too, in general, when we get worried about a heart rate being too low, is when a person is feeling dizzy or lightheaded about that. My resting heart rate is about 50, in the 50 range. And I have patients that I see are resting in the 50s as well. So it's really about how you're feeling with that heart rate.
So I'm going to ask one question that I already know the answer, kind of, which would be some of us, a lot of us, we may be feeling a little lightheaded or what have you, and we take our blood pressure and we discover, okay, it's time to take our medication, but our blood pressure is already like 110 over, let's say 70 or 60. And we start to think, well, maybe we shouldn't take our medication. So I think, and I'm not going to say you should or you shouldn't, I'm going to say it's a conversation for your doctor. But in those circumstances, what have you told your patient?
So my patient population is a little bit different because I deal a lot with, I should say, I deal a lot with patients who have heart failure. And in that patient population, we tend to have much lower blood pressures. But the reason, so one thing, because a lot of your medications may be lasting more than that full 24 hours, you're still going to want to take it because it's what's keeping you there. Now, I will say, if you are feeling dizzy or lightheaded at any point, it is really great if you have that blood pressure monitor, sit there for 5 minutes, take your blood pressure. If your blood pressure is lower than what your normal is, that would be a reason to call the office. And then they can make that determination with you. Okay, is there a specific medication we want you to lower the dose on? If you're feeling dizzy or lightheaded, I would, right, unless you know your blood sugar is low, it would be a good reason to call the office right away in the morning so that they can make that decision. And depending upon an individual, you're going to pick one medication maybe over another to lower the dose if you need to do so. So having that number when you call can be really helpful.
Right.
And if you feel comfortable with it too, take your blood pressure sitting and then take your blood pressure standing, because we can use that data sometimes to tell us too if this is about blood pressure that's making you feel dizzy.
Mm-hmm. Okay.
Good question.
Let's see if there's any other questions. Hi, Alan.
Hi,
Thanks
Alan.
for joining us. Let us know if you have any questions. We appreciate the support. We appreciate you watching. Do we have any other questions? Because I couldn't always come up with another one. Okay. So my other question, you had mentioned that this can affect libido, and you specifically said men. Can this actually have an adverse effect on libido in women taking some of these drugs?
Yeah. So libido and erectile dysfunction are kind of two different ball games. So libido is like the interest in participating in sexual activity, and then erectile dysfunction is erectile dysfunction. So like attaining or maintaining an erection. So sometimes if someone is feeling sluggish, that could potentially affect things. And I think another thing to always think about too, I think we underestimate the impact that mental health can have on us, and especially when we have chronic conditions, right? That depression can definitely play a role in some of that, so there may not be that interest. So I think that is if you ever would experience that is a really important thing for women can discuss with their gynecologist. You can discuss with your primary care doctor, anybody, because mental health can play a big role in that. And there's so many different things that can impact the desire to participate in sexual activity, that you really have to do your digging with patients sometimes to figure out what that maybe root cause is. One thing that I didn't put in the slide that we've covered in the past when we do this fall session is about cough and cold products.
Just going to bring that up and tie it into allergy season.
Yeah. Oh, yes.
Because that is big, and people ask a lot of questions about any over-the-counter medication.
And I really hope most of you are not suffering like we are. Maryland's giving us a real run for our money.
That's right. We'll be in soon. I'm looking at the countdown here before those cicadas break out of the ground, and then we're all going to run back indoors.
That's right. So when we're talking about when we're taking anything for pain, if we have a head, like if your allergies are giving you a headache, or acetaminophen or Tylenol is going to be your best bet. And the reason I say this is because now some of you are younger, but as we get older, taking medications like ibuprofen, Motrin, Aleve, they can increase our risk for having heart attack or stroke over time, especially if you've already had a heart attack or stroke. It increases that risk. If any of you are on something, say like aspirin, after an intervention that you had for your aortic disease, it can increase your risk of bleeding as well. So Tylenol is safe to use if we're using it in the right amounts, and you can follow that labeling on the bottle that you provide. So stick with that. And then with allergy season, you're A-okay to use those three big we think brand names of allergy medications: Allegra, Claritin, and Zyrtec. Go with the store brand. They're all very expensive. That you can use those. The nasal sprays, they are fine, like the Flonase, things that you'll see is like a steroid nasal spray. And if you just go up to the pharmacy counter, they can tell you which of those are a steroid nasal spray. Those really do not get absorbed into our body, but they are phenomenal at treating allergies. And then the same with the allergy eye drops. They are safe to use. If you notice you're getting stuffy, congestion, I'm a big fan of the $2 Ocean nasal spray or the saline nasal spray. That does not will not interact with any medication. It's not going to impact your blood pressure. So that's a really great option for people as well. And you can close your windows in allergy season to put that air on.
Put a mask on, right? They've been helpful for so many things, honestly. I think one of the biggest things that I took away from this, as I take away every time, is that there are plenty of people out there that never took medications on a regular basis before this happened. There's also plenty of people that just don't like swallowing pills. They just don't like all the medications. They feel toxic. They don't feel clean. And you don't have to be on necessarily a million pills. I mean, maybe you do, but at least the conversation is there. The door has been open for you to step through and say to your physician, I'm struggling with this. This is impacting me in a variety of ways. I mean, because it can be very impactful from a mental health perspective, as you mentioned. And so to be able to take this conversation, this presentation, and say, you know what, I think this is what I'm feeling, but it could be this and it could be this. Let's figure this out. Because you shouldn't be stuck in a life where you're dizzy all the time or you're sleepy and lethargic all the time. That can be fixed. And I think it can be modified and adjusted with a simple conversation and mentioning something that you've learned today or you've read today or tomorrow or whenever you're seeing this off the slides. And I don't think a lot of people realize that, or I think they take it for granted that you're told take it, so you take the medication. And I think this is so valuable because we realize now we could and we should speak up for ourselves and see if a change can be made.
Yep. And you bring up, and you said before, Karen, you didn't know you can ask questions. Sometimes we have to be our best our own advocate. And sometimes it isn't the medication. And sometimes they're going to do some digging, because there's a lot of health conditions that can sometimes mimic some of the side effects that you could potentially get as well from some of these medications. But, you bring those up. And it's really important that you find a provider that's going to listen to you and engage in that dialogue and ask the questions, right? Why am I be giving this medication? Even if they told you 10 times before and you forget, ask that question.
Exactly. Let me check one last time for any other questions. And I think we are good. So if we get questions in, I'll be sure to field those to you for answers. Kristin, as always, it's wonderful to see you, to get this information again from you. I know I'll be having conversations, and I hope other people that are watching this will take this information back. So thank you again so much for joining us. It's so appreciated.
Thanks for having me.
All right, everybody, don't forget to like and subscribe by clicking the button below and ask questions. And we will see you soon on Aortichope AHTV. Thanks again so much.